The army ant is placed on the wound and positioned so its jaws clamp tightly on the edges, securing them together.
What would we normally do with a suture, right, or a stitch? You literally take your needle that has a curve, typically nylon as the material. You make an arc, you go underneath, and you tie it, and it becomes like a big circle like this to approximate the wound edges.
The ant's body is twisted off,
Stop
leaving
it.
its head and mandibles in place, which acts as a stitch. More are added depending on the size of the wound.
You still need to prep the tissue to make sure you don't get infection. Same with somebody who comes to the hospital. We got to clean the skin around it before I make those sutures because there's bacteria on the skin.
These ant stitches are left in the skin until the edges of the wound stay closed on their own.
This is actually used in areas around the world where you don't have access to potentially a suture and you need something to close your wound. Handling them and controlling them, I think, takes a little bit of time and practice. Any of you out there ever done this before? It's actually pretty crazy and cool and sad for the ant, but you heal.
If your ear gets ripped off, you can actually take some cartilage from your rib cage.
Yeah.
Then a doctor will carve it into the shape of an ear and place it into a pocket of skin on your forearm.
Our ribs attach to our sternum by cartilage. Sometimes people end up getting costochondritis, which is inflammation of that cartilage, which causes sharp chest pain, just so you know that there is cartilage in that area and it does get inflamed, and we can use it for other means.
Inside your arm, it develops and forms new blood vessels and skin. Once it is fully developed, the new ear is removed from your arm.
Your ear is all cartilage with some blood vessels and skin around it and a little bit of subcutaneous tissue. Can you put it in a pocket somewhere? Anywhere? Yes. Forearm, hip, belly, anywhere.
The new blood vessels are attached to your ear hole, and the skin is carefully stitched to your head, giving you a new ear.
Can you then put it back on? The issue will end up being the nerve growth. So you have neovascularization, so new blood vessel growth, but nerves take a lot longer. And is that ear innervated, or do you have like nerve function to that area? It could take a long time to get that to come back. If it does,
a doctor could theoretically sever all of the blood vessels in your neck and connect them to the neck of a donor body. Then the muscles, tendons, and bones are precisely cut and your head would be fully disconnected.
Yes, but nerve function probably, most definitely at this current time, would not be functioning appropriately.
The surgeon would then spend hours reconnecting everything in your neck to the donor body. And once everything is attached, in theory, your head would be completely joined to a new body.
Could you take those blood vessels methodically and attach them? Yes, you could. And muscles, bone, ligaments, tendons, all that stuff could be reattached. The minute you sever that spinal cord, then there's no more function. So there hasn't actually been a successful head transplant in medicine.
If someone has bone cancer in their femur, a surgeon will sometimes amputate the affected area, removing the entire middle part of the leg. But they leave the major vein, artery, and nerve intact.
How amazing is that? But it's true. Bone cancer in this specific area you don't see so often, where it's just isolated, where they just need to have this amputation. But people do get bone cancers, and if you can fix it in such a way that gives them a meaningful rest of their life because you're able to save the joint, it's amazing.
Then they bring the lower part of the leg up and rotate it 180 degrees. By turning backwards, the ankle joint essentially becomes...
How cool is this?
This is because it can mimic the knee's bending motion.
I've done amputations when I was a resident. You're leaving a stump, and that could be painful, uncomfortable, putting a lot of pressure on an area, versus here, your joint's going to change and have to adjust, but our brains are amazing. They can figure that out.
And while it might look bizarre, it's actually very helpful for amputees. The backwards ankle fits perfectly into a prosthetic and gives more stability and mobility.
You keep the ankle, but you keep the foot. There's no need to get rid of the foot. It actually gives it more of an area of structure and support.
In 1848, a large iron rod drove through the face and head of a man while he was working on a railroad.
This is why I say never pull anything out, because you need a surgeon there to just to double double check structures it's going through.
It passed behind his left eye and exited through the top of his skull, and he somehow managed to stay conscious while the rod was removed.
Went through the face, so you're bleeding, fractures. The left eye probably wasn't functioning anymore because behind the eye, you have your nerves, your muscles, so if that connectivity got messed up, the likelihood that you'd be able to fix it is pretty darn low.
Now, he did survive this incident, but he wasn't really the same person. You see, the rod went through his frontal lobe, and this area of the brain is responsible for decision-making and self-control.
Very good example of frontal lobe injuries. It's very similar to what we've seen when people get shot, you get a stroke in the same area, personality change, decision-making. You see a lot of this too when somebody might even have Alzheimer's, where the Alzheimer's is affecting frontal lobe. Sometimes we'll even see this when somebody has a brain tumor that nobody knows yet.
If you were swallowed by a sperm whale, you would be squeezed down its massive throat. You'd continue down the esophagus and into a series of stomach chambers that are filled with digestive acids.
Stomach acids are designed to break down what you ingest, and they're highly corrosive. The stomach lining has to rebuild itself because of the acid environment.
And these acids would immediately start breaking down your body. But even if you managed to avoid the acid, the lack of air inside the whale would quickly cause you to suffocate.
Now you're inside a closed chamber that oxygen is not getting into. So you're breathing out some oxygen, but you're mostly breathing out CO2, right? Most of the time you're going to suffocate, but you're actually going to get lightheaded, dizzy, and slowly fade away.
If a kernel of corn somehow got up your nose, some people think that it could potentially sprout, meaning you'd literally be growing an ear of corn in your nose.
We do pull a lot of foreign bodies out of people's nostrils. Typically, many different tricks to get it out. If something is stuck and it's further back, you can just blow it further into the back of the throat. Just don't inhale it.
Now, this is obviously crazy, but a 4-year-old once inhaled a bean, which then got stuck inside his nose. And because the nasal cavity is warm and moist, it allegedly created a suitable environment for it to germinate.
Another way is if it is your own kid and say it's more in the front of the nose, you can blow air into your child's mouth, hold the one nostril that there's no foreign body in, and it should come shooting out.
After several days, the seed actually sprouted and began to grow until it was removed by doctors.
That one was easy because the sprout came out, so you just grab onto it and gently pull. There's another thing that we use. There's a device that's almost like a very thin stick that has a little balloon on the end, but the balloon is collapsible. So you put it past it, blow the balloon up, and just pull it forward.
If you stopped blinking for 30 seconds, the moisture on your eyeball would start evaporating. And over the span of a few minutes, the first layer would dry out since it relies on the eyelids to cover it with moisture.
When somebody's having procedures done of their eye where their eyes are open like this, the doctor is going to be using ointments and drops to keep your eye moisturized. In the emergency department, the most common area that I see this happen is when somebody has Bell's palsy. Bell's palsy does not allow you to totally close your eyelid and blink, so it dries out your eye.
He had another head growing right on top of his own, one that could blink and smile independently.
Wow.
And this head was actually his twin that didn't fully separate in the womb.
Which is actually called a parasitic twin.
It would cry when he laughed and stare blankly when he slept. Now, each head was actually functioning off of their own separate brains.
So it depends on the attachments, depends on how this formed. It's not always like two separate brains or separate organs. Sometimes they can be sharing.
If your nose gets sliced,
getting your nose chopped off, you could have bone that goes with it, but most of the time this part of your nose just has cartilage versus the bone at your bridge. It is open, so you might actually have like a prosthesis there temporarily.
Doctors can place tissue expanders under the skin of your forehead. Once it is stretched out enough, they'll shape it into a nose. Then they take some cartilage from your rib cage and craft it into an internal structure.
Tissue expanders, usually it's almost like expanded by air, like a balloon underneath the tissue, a device that's put under there. You slowly stretch the skin because it does hurt. There's increased pressure there. Is it going to be unsightly? Yeah, potentially.
Which is then placed under your new forehead nose. Over several months, the new nose will will take shape and develop necessary vessels. It's then removed from your forehead and surgically transplanted onto your face.
Growing the nose on the forehead is actually a technique plastic surgeons do. It's called a forehead flap. You do run the risk of that tissue not having good blood supply when you reattach it, and you can have it become ischemic and necrose and turn black and then not take. That is a risk.
If you somehow removed all the blood vessels in your body and tied them together, you might think it would be about this long.
Longer, much longer.
It has thousands of these tiny vessels.
You can see your veins and your arteries and these big vessels, but we have small little ones everywhere. The venules and the arterioles and even capillary beds.
With all of them combined, it would go on to reach all the way across the Pacific Ocean. Not only would it make it all the way back to your starting point, but it would be able to make this trip 2 to 4 times.
Wow, how amazing is that? Your arteries, your veins, the capillaries, all the sizes in between make up your cardiovascular system because your heart's involved in that. But then you have your other systems that are other highways, like your nerves or your lymphatics.
If the rotating chainsaw of the bar hits something solid, the chainsaw can suddenly kick back toward the operator.
As an ER doctor, I've seen this more than a few times. Haven't seen any complete amputations, but seen partial amputations from chainsaws and massive destruction of tissue because it's a chain that rips.
Now, unfortunately, this usually happens in the face or neck region.
Yep. We're always talking about zone 2 of the neck. Major blood vessels to this area only covered by some simple skin and muscles. You got all those funny lines, and then you got the sternocleidomastoid, you got your scalene muscles. They're there to protect and help with movements of the neck, but they're also there to protect the major structures underneath.
If you lose your thumb and it's not able to be reattached, you'd probably think you'd be thumbless for the rest of your life. But that might not be true.
A lot of times when we amputate fingers, they're actually not able to be reattached. Most of the amputations that we do see are usually at the distal phalanx, so there's less blood supply, smaller structures, harder to reattach. But you try to reattach it if you can.
You see, a doctor can actually take your toe from your foot and meticulously graft it onto your hand.
Has anybody had this done to them, or do you know anybody who has any toes as fingers? Let me know in the comments.
Once it adapts and heals, the toe functions almost exactly like a thumb, giving grip and dexterity.
If you lose a finger, get bleeding control, then get the digit that is now amputated off, maybe wrap it in gauze, and you want to put it in a cold water ice bath, but not directly on ice, and bring it with you to the hospital.
He burned his initials onto the liver with a high-powered laser. Then he sewed up the patient and acted like nothing had happened.
Before you have a surgery, you might take a marker and mark like left side, right side, what area is going to be removed. Patient sign it and the surgeon sign it. That way everybody knows where you're operating so you don't have that error. But branding a person's organ, you're ruining or injuring an organ. That is awful.
Hey, that's awful.
The new liver started to fail. The patient went back in, but this time she was treated by a different doctor, and he soon found the initials inside. He eventually lost his medical license.
Wow. The liver can regenerate from injury. If there's not enough healthy liver, it may not be able to regenerate enough. There are other surgeries that you can do to block blood supply to one side of the liver that might be damaged, and it forces the other healthy side of the liver to grow a little bit more to take over.
If you lose your hand...
Whoa. Super cool, just imaging wise. We're missing some underlying tissue, but you're seeing vessels. You're seeing the bones of your forearm, not the bones of your wrist.
If your blood vessels and nerves are in good shape, you might have another option. You see, a doctor can take a hand from a donor and meticulously connect the bones, veins, and muscles to your arm.
Yes. If you don't have your own hand, there's the potential of a donor hand or a cadaveric hand. As long as everything is still relatively intact and you can reperfuse it, then yes, that is a great potential and amazing.
The man fell onto an air hose, and the nozzle pierced his butt. It pumped air into his body at 100 psi.
Whoa.
In minutes, the man swelled to twice
Get it out of there.
size.
We see injuries like this relating to power washers or paint sprays get underneath the tissue and you get subcutaneous air. The one time I ever tell you, don't pull it out, this time you want to pull that darn thing out and get it out of there.
The air had filled his abdomen, chest, and even his face. Paramedics tried to treat him, but the pressure pushed the IV out of his skin.
Wow. You worry about air in the body when it comes to your blood vessels because you don't want the air to get into different areas like your brain, which can cause an air embolism, or within your heart itself, where then you're actually not pumping the right amount of blood or it's blocking blood flow.
The man deflated back to normal after 3 days and ended up living.
That image of him farting it out, unlikely. The body will work on reabsorbing it and getting it out of the body.
If you touch a cactus, you'll probably get the spines stuck in your skin. And if you try to pull them out, you can actually break them off in your flesh. So fragile. You should apply a layer of glue over the area. Once it is dried, quickly peel it off in a smooth motion. This will pull out the spines evenly, causing them to stay intact.
You can use this for a technique of splinters. So splinters are really small. These are big splinters. If they're flat, you can use duct tape. Tweezers, you're trying to pull them out and you're putting a lot of force in one area, which increases the risk of breaking.
This powerful organ beats about 100,000 times every day and pushes about 1.5 gallons of blood through your body each minute.
The heart squeezes a ton. And actually, it's interesting, it doesn't squeeze to empty. There's something called an ejection fraction. 55% is squeezed out. When it's too much, you don't want to squeeze all the blood out of there, and then too little, we don't like that. That's bad as well. You want to be right in the middle.
If your eyeballs fully popped out of your head, you would completely lose your vision.
Yes, the eyeball itself is multiple muscle attachments, 6, and then you have your optic nerve that comes out the back of the eye.
Well, most people think that you would see darkness.
No, you probably see light.
Black. But that's not actually true. You wouldn't see darkness because you wouldn't see anything at all. It would be like trying to see out of your elbow.
Messing with the nerve could send some wrong firing and might give your occipital lobe in your brain abnormal input. Could there be flashes? Could there be brightness? Could there be absolutely nothing of nothingness? Very interesting, very hard concept to be so black and white on, literally.
There's no visual input, which means you quite literally see nothing. Not darkness, not pitch black. Nothing.
Everything.
If you've previously had vision and then you've lost vision, you won't be able to see, but your brain has previously seen and has images in there. You might actually have visual hallucinations. If you were born without ever seeing, you only perceive nothingness and you don't have any preconceived images in your brain.
When a magician swallows a sword, they completely suppress their gag reflex as it enters their throat.
We place patients in this similar position when we need to do an airway in the emergency department, or even when you undergo anesthesia. You're getting in a specific angle that before we had technology, we had to visualize somebody's vocal cords when we had to put in endotracheal tube, and we're still trained that way in case technology fails us.
The blade is then carefully aligned as the performer leans back to straighten the natural curve of the esophagus. Then the performer pushes the sword down the esophagus, being cautious not to enter the trachea.
You're going into the esophagus. The reason why you're not going into the airway is because we have different protective mechanisms, specifically your epiglottis. Your epiglottis helps prevent you from getting things into your airway and allowing them to go into your esophagus, so they go into your stomach.
The sword is then stopped right before it reaches the stomach and carefully pulled back up the throat.
The soft tissue of your GI tract, mouth to anus, is very robust and doesn't get cut as easy as we all would think. How do I know this? People swallow things left and right and come to the emergency department. Razor blades, screws, nails, and very rarely do they have any massive GI bleeds or massive injuries.
Last year, a surgeon completely removed a man's damaged eye.
So just so we know, these are good images, but there's 6 muscle attachments to the eye, plus there is the optic nerve in the middle that comes off of the blood vessels. Just telling you.
They connected the eye muscles and blood vessels to a new donor eye.
Cool.
This experimental surgery was done to fully replace the man's eye, allowing him to see again. But the surgeons weren't able to fully connect the optic nerve.
Anytime there is a neurologic problem that we're trying to fix by transplanting, there's always issues with the connection of the nerves. Otherwise, we'd be doing so many different type of procedures. Brain transplants, reattach somebody else's leg as a donor leg.
This nerve is essentially what allows you to see. So while the transplant was technically successful,
Technically successful because you can reattach the muscles, reattach the vascular issues, so reattaching the blood supply. Are the nerve cells dead? Do they regrow? Do you get any function back?
the man's vision was not restored.
They showed almost like a cataract type opaqueness of the eye, which you wouldn't necessarily have in that situation. That's a whole different process, but it's just a visual image to show us, okay, that the eye is not functioning.
If you took out both of your lungs and somehow unraveled all of the tiny air sacs, most people say that it would completely cover an entire tennis court.
All the air sacs, aka the alveoli, where the gas exchanges occur.
The average size of the surface area of both of your lungs is only about 1,000 square feet, meaning your lungs would only cover about half of the court.
The lungs are amazing in the sense of expansion, the gas exchange that is occurring, how much vasculature is within the lungs, and even just the touch of the lungs. It's like a really wet sponge in certain circumstances. Such an interesting organ.
If you have frequent nosebleeds, there's a crazy chance that you could have a tooth growing in your nose.
What? This video now is going to change the way I see a bloody nose. I'm always going to be looking for a tooth. It's super rare. The most common reasons why people get bloody noses are due to either a nose pick or a foreign body that was put up there not because it was there since you were born, as well as some vascular abnormalities.
This incredibly rare condition begins in the womb when a developing tooth bud migrates to the nose. And years later, once the tooth has developed, you might begin to experience chronic irritation in your nostril.
There are 2 common areas where you get nosebleeds, one in the front on either side of your septum called your Kesselbeck's plexus, and then in the back you can have some posterior bleeding due to other major blood vessels.
To remove it, a doctor will insert surgical instruments through your nostril and carefully extract the tooth.
If somebody comes to the emergency department, what the heck do we do? I hope you come in holding your nose and pinching and leaning forward. Do not lean backwards. If you lean backwards, the blood's going to continue to trickle down the back of your throat, potentially go into your stomach, causing you to be nauseous, swallow blood, and cause some vomiting.
If you get rid of your arm and leg bones, your torso would still be somewhat intact. But if you took out your pelvis, spine, and skull, you would no longer have the framework that supports your body.
Yes, we do see individuals that sometimes have to have bones removed, but a lot of times you're removing the tissue with it just because of the lack of support. It increases the risk of vascular abnormalities, injuries, lack of movement, more of a nuisance for the individual.
He dialed the phone using a pencil as blood poured from the stumps where his arms should have been. You see, they had been ripped off after his shirt got caught in a machine.
Horrible. Really good. Thinking on your feet. This does happen. Please be careful. He's bleeding out. Major blood vessels. Brachial artery is just destroyed. Hopefully there's enough vasospasm or spasming of the wall of the arteries that it's slowing the blood down a little bit.
He walked 100 yards to his house and opened the door with his mouth. Then he used a pencil to dial 911. Once help arrived, they found his arms.
What do? You grab the limbs, just grab them and go. Trying to find ice and water bath. Time is of the essence, so get the individual to the hospital. 5-minute ride is not going to do probably that significant of damage if you're waiting 5-10 minutes to try to find a ice water bath to put them in.
Doctors were able to reattach the bones, veins, and skin while he was in a coma.
The question ends up being, was he in an induced coma by intubating and giving medication to put somebody asleep, or was he so out of it due to lack of blood flow to the brain that he suffered brain damage leading to a coma that he's in, and over time eventually came out of it?
He spent weeks in recovery and eventually regained use of both arms.
Wow, amazing. I would say he probably had hypovolemic shock. They were able to resuscitate him and then kept him intubated and down while they did everything that they needed to do.
They connected the blood vessels as they pushed his amputated hand into the incision on his calf. This pumped fresh blood into the hand, keeping it alive.
How amazing is that? And this is actually quite common. It's been going on for a long time. I worked at a burn center in Massachusetts. They were doing procedures like that. It was amazing. It's not like it's just kept there overnight. It's kept there for a while. And so you have to stabilize it and make sure it's okay.
You see, he had gotten into an accident at work.
Oh my gosh, I have a good friend who did something similar, but only took off 1 digit and he's doing fine.
And doctors knew they had to act fast, but his arm was too damaged to reattach it right away. And if the hand didn't get blood soon, the tissue would die.
With this type of saw injury, you would expect it to be pretty clean, so that's probably why they were able to reattach it. But if it was like a chainsaw, it might be so jagged that the tissue is so beat up that you can't find the specific anatomy to reattach things to.
So they decided to attach it to his leg while his arm healed. Then, once it was ready, the hand was still fresh, and they were able to reattach it.
Unlikely that they reattached any nerves or anything like that in this area, but giving some blood supply to this area is pretty amazing. It takes a long time for probably the hand to get its nerve function back, but it's alive, it's got blood supply, and giving the patient a chance.
A woman suddenly lost consciousness.
Lost consciousness does not mean that your heart stopped and you died. You could pass out from a procedure. You can have a syncopal episode, decreased blood flow to the brain for a second. If this happens, call 911, get the heck out of there.
While a fake doctor was performing an illegal laser treatment on her.
A laser procedure, which is pretty benign.
9.5.
She must have had just some sort of unique event. Is it laser hair removal? Is it some sort of dermatologic procedure that they're doing that's not massively invasive? I'm thinking, could there be a blood clot that was formed versus somebody just passing out due to the procedure itself?
Instead of taking her to the hospital, he shoved her body into a suitcase. He left this suitcase in his garage for weeks while her family and police searched for her.
Without oxygen, elevated levels of CO2, passing out again, becoming hypercarbic, and then no food or water for a while, which then increased the likelihood of dehydration and potentially dying that way.
To hide the evidence, he buried her body in the garage and poured concrete over it. The remains were discovered nearly a year later, and the man was sent to prison.
Wow. There are individuals that's fake being a doctor, so please make sure that you look up the doctors that you have, make sure they are credentialed. The doctors in the United States, we have to have multiple different licenses for different things and different board certifications if we're working in different specialties.
He noticed his nipple leaking out of nowhere. So he went to get an x-ray, which revealed a knife in his chest that he didn't know about.
What? At first I was like, oh, galactorrhea, you were having nipple discharge in a male, you're very concerned about like cancers or hormonal abnormalities. But no, it is a abscess in the tissue that is then eventually forcing its way out, just like any foreign body would in our body.
Years prior, he was stabbed in the back during a fight, and the knife had slipped through his shoulder bone, falling into his chest cavity without him ever knowing.
Stabbed in the back, broke through the scapula, broke through ribs, went through lung tissue, not causing issues relating to breathing, no pneumothorax, no hemothorax, no chylothorax, no infected lung tissue. Really interesting.
His skin closed over it and sealed it in. But over the next 8 years, it slowly got infected, eventually forcing the pus out of his nipple. Doctors performed surgery to remove it, and the man survived for the second time.
What? That is crazy. That is a crazy story. Because it was a knife, it actually will reflect or block the beams, so it actually will show up on the images. But there are materials out there that actually don't show up on x-rays.
The gum exploded inside his mouth the moment he started chewing.
If you have a massive amount of facial trauma, it doesn't necessarily mean you're going to die. What's going to kill you is the airway, bleeding out, and if the explosion did anything related to the brain. You can blow off your jaw, rip out your tongue, but still be alive.
Before chewing gum, he liked to dip it in citric acid.
Oh no.
He accidentally grabbed the wrong jar. Instead of citric acid, he coated his gum in an explosive chemical, and it instantly destroyed his jaw and lower face. His family heard the blast and ran to his room, but he was already dead.
If the individual has a pulse, what do? You can't use the bag valve mask. There's no place to put it. Sometimes EMS is able to put the tube into the trachea and protect the airway. If the person is still breathing on their own, you're trying to prevent blood from getting in their airway, supplement the oxygen as you can, and get them to the hospital ASAP.
As she yawned, the round end of her jawbone slid out of its socket, and the muscles around it pulled tight, but couldn't push the bone back in place, leaving her jaw stuck wide open.
Awful. This does happen occasionally. That does come to the emergency department, a jaw dislocation. Some people are more apt at getting it than others. Usually happens when you're opening your mouth really, really wide for whatever reason, and usually it slips forward.
Doctors took x-rays and saw the joint was dislocated. She waited for hours, jaw still hanging open, until they finally sedated her.
When it comes to sedation, we're using medications that last just a couple minutes to have you fall asleep. You do not need a breathing tube for this. This is a procedure that is pretty much bread and butter of emergency medicine.
4 doctors pushed and pulled until the bone finally popped back into its socket.
As an ER doctor, we are trained to put these back in. Having somebody sit up, put your thumbs in their mouth with gloves on, and sometimes either popsicle sticks around your own fingers or gauze. That way somebody doesn't bite into your own fingers. Downward traction and a little bit of pull forward and back.
He fought for his life until someone finally noticed and pulled him out.
Oh my gosh.
He'd been cut off. His coworkers tied ropes around his stumps to stop the bleeding.
The workers did a great job, right? So they used whatever they could to reduce blood loss. Rope is fine, but you need something to tie the tourniquet. Maybe you stick some sort of hard, unbreakable piece of metal or something like that to help spin it even more. It's going to cause pain, but you're trying to prevent somebody from dying at this point.
His heart stopped on the way to the hospital, and he needed 15 pints of blood. But somehow he survived and still lives an active life without his legs.
We are made up of about 10 to 12 pints of blood. Usually if you lose 40 to 50% of your blood volume in one moment, you're going to pass away. You go through different stages of hypovolemic shock relating to tachycardia, hypotensive, decreased organ perfusion, no urinary output.
He was way too short to join the army, but a tumor was developing in his brain.
Short individual that then developed what's most likely a pituitary tumor. Pituitary has to do with a lot of hormonal regulation in our body, one specifically growth hormone.
It triggered his hormones, and suddenly the 4'6" man started to grow.
Growth hormone starts significantly increasing. We're gonna start seeing massive amounts of growth to an individual where you wouldn't expect it. Something more commonly that we've heard of, something called acromegaly, which is the basically inappropriate secretion or increased secretion of growth hormone. You think of people like Andre the Giant.
His hands, feet, and tongue expanded, and he grew over 2 feet in just a few years.
Wow. You can still have pituitary tumors that don't actually then cause any significant abnormalities. You can have inappropriate secretions causing Cushing's, or you can have something called a prolactinoma, which is inappropriate production of prolactin. In the ER, when we do CT scans, sometimes we see pituitary tumors, but then patients are asymptomatic and just need to be monitored.
His spine curved. Soon his vision blurred, and eventually he had trouble hearing.
Complex reasons why somebody would lose hearing with this. One, the tissue could be growing just like everything else is growing, or there's issues relating to the nerve. Same with the vision loss. Because the tumor is growing, it could push on the optic nerve.
Finally, doctors removed the tumor, which slowed his growth, but it didn't didn't stop it completely.
They did a transsphenoid removal, basically going through your sphenoid sinus to get to the brain.
By the time he died, he was 7'8", making him the only man to live as both a dwarf and a giant.
Wow. Pretty amazing. And yes, people who ended up having this type of inappropriate secretion of growth hormone don't live to the normal expected lifespan for somebody their age and sex.
He built the Lego bricks around his arm stump when he was just 9 years old.
Looks like this individual has transverse limb deficiency, basically where it stops developing around the elbow. Could be above, could be below.
Hoping to create a prosthetic arm.
He still had function of the joint at the elbow potentially here, so you could bend, and there appears to be some remnants of like fingers. They could be used to mechanically move things.
In the womb, his right arm never fully developed.
This individual was born without a complete or fully developed extremity, which does happen most of the time. Now you're doing anatomy scans and when somebody is still in utero, so you might find this out before the baby is delivered.
He made his first Lego arm. Now, that first version didn't work, but he tried again years later, making an arm with a movable elbow and a grabber to pick things up.
See here, you have multiple joints, you have opening and closing of the distal grasping mechanism, and that's controlled by the arm, controlled by your brain. But if it was just higher up and a kind of a stump at that point, then it would be a lot more difficult.
He was working on a shoe when his thumb got caught in the trimming machine.
Yep.
And in a split second, the blade had sliced through his thumb, dropping it to the ground.
Oh no, you gotta be really careful. I've had patients come in where they lose digits because of a very similar event. Control the bleeding as best you can. Find the thumb, bring it with you. If you have time, put it in a cold water bath, maybe with some ice, but not directly on it, wrapped in something to protect it, and get to the hospital.
He was rushed to the hospital where surgeons amputated his big toe. Next, they connected the blood vessels, nerves, and tendons where his thumb used to be.
Okay. He's told us on that side, it's great toe. It's going to inhibit movements, pushing off, good balance, those sorts of things. But would you rather have the ability to use your hand appropriately, especially maybe if it's your dominant hand, versus, continue to be a sprinting athlete?
After months of physical therapy, he could use his toe just like a regular thumb, allowing him to use his hand and get back to fixing shoes.
Because it's your own, you're not going to have a rejection of it. You just need to make sure that you attach the blood vessels well, the nerves and the tendons. There's something called a replantation team, to where there are specialists that will actually replant limbs back on the body, and they're specifically trained for this.
A man fell face first onto an 18-inch drill bit after his ladder broke.
Awful.
That's awful.
You guys always know what I'm gonna say when you have an impaled object. Don't pull it out. Even if you couldn't, don't attempt to pull it out, because you don't know which structures it's hitting or not hitting. You might freak out. Remember, just count to 5 before you do anything. Just pause for a moment, get your bearings, then assess the situation. Just stabilize it and get to the hospital.
The bit penetrated through his right eye socket and exited behind his right ear. In shock, he felt the bit lodged in his skull and was rushed to the hospital.
Gotta reverse it. Reverse! So it didn't hit the temporal lobe of your brain. Bone destruction, soft tissue destruction. If it's that close to the brain, really, really concerned about getting an infection.
When doctors went to remove it, they found that it had somehow managed to push his brain to the side instead of impaling it. It was carefully removed and he fully recovered.
Fully recovered? Are we saying that he did well to where it missed his eye and his eye is still intact? If it went right into the eye socket through the eye, you're not going to recover the eyeball. The eyeball will be gone.
A cannonball would leave a massive hole in your chest, but your chest is full of important stuff, like your heart and lungs.
That's actually a good picture, and you're seeing that thing that's underneath the lungs. That's actually your diaphragm, I think is what they're trying to show. Very good imaging. I love good animated anatomy.
If the cannonball somehow missed all of that, could you actually survive?
If a cannonball went right through your chest in the epigastric area, just below your heart, missing all your major organs and blood vessels, yeah, you could survive, but you have the other component of you're not going to be able to walk, probably, because it's going to destroy your spinal cord.
Well, doctors would have to stop the bleeding and make sure the insides stay cleaned.
It wouldn't be as simple as stop the bleeding. It would be resuscitate you, give you blood back, try to repair all the major blood vessels that have been injured, chest tubes in both sides, make sure there's no blood around the heart that's causing a cardiac tamponade.
Then they would have to take skin from another spot of your body and use it to cover the edges.
Yes, you can use a skin graft from somewhere else. That is an easy repair. That's like the easier part of the story. But the harder part is making sure the person doesn't die from the initial impact. I don't think this injury was compatible with life.
The tube is guided through your eye socket if your face is too injured for a regular breathing tube.
You're doing a blind procedure. Very rare, very dangerous. Most doctors won't do this type of procedure.
You see, your eyes, nose, and throat are actually all connected. And when the tube is pushed through your eye, it makes its way into the open space behind your nose.
If it's an emergency and we have to intubate you, we're going to try to put a breathing tube through your mouth. So we will do that first. If we cannot, you can try to do a nasal intubation, but that is not as good.
It's pushed downward into your airway, and oxygen is pumped into your lungs, saving your life.
You're probably going to go for a crike. It sounds scary, but you make an incision in the neck and you cut the cricothyroid membrane and you get into the airway right there and put a tube.
A metal guardrail shot through the windshield, impaling a man in the front seat.
Yep. This is a classic Dr. Wagner moment. Please don't pull it out, which they appropriately did. Get to the hospital, get some imaging, get assessed, get the patient to the operating room.
Firemen spent an hour shortening the 13-foot pole.
I can't imagine the discomfort as the blade is vibrating that pole.
Surgeons discovered the pole was 2.3 inches in diameter and had missed his heart by just half an inch.
It's a hollow pole going through the thoracic cavity. It probably cut through bone, it probably cut through lung tissue, but it missed the heart, probably destroyed the scapula on the back.
During surgery, doctors carefully removed the pole, avoiding major blood vessels and vital organs, and the man ended up living.
So there's a lot more going on and a lot more procedures that are needed probably in this scenario, but it's a survivable injury as long as no major, massive injury occurs.
You could swallow a whole watermelon.
What?
If your jaw worked like a snake's. But as it traveled down your throat, it would crush your windpipe, cutting off your air before it even reached your chest.
I don't typically like general terminology like windpipe. It's your trachea. It's got tracheal rings, so it's got cartilage to protect and keep the airway open, but on some of the smaller areas, cartilage doesn't go all the way around. That's where it can compress down.
Your esophagus isn't stretchy like a snake's, and the watermelon would slam into your lungs and heart.
The esophageal tissue could rip open, causing something called a Mallory-Weiss tear or Boerhaave, and then you can get fluid and air into your mediastinum, into your chest, which can cause bad infection, mediastinitis, compressing your heart, not just exploding it, so to speak, but not allowing the normal cardiac output.
Even if it somehow reached your stomach, it wouldn't fit, meaning you wouldn't have the acid or enzymes to break it down. At that point, your only option would be to throw it back up, but forcing it out would cause just as much damage.
Lower esophageal sphincter is going to be open. You're going to have acid reflux. With individuals that have gastroparesis, so slowing of the stomach motility, or cannabis-induced hyperemesis syndrome, or any other vomiting syndromes, their stomach doesn't move things out, so people will induce vomiting.
His 20-pound metal necklace started to pull away from his chest as he stepped into the room.
Why did he go into the MRI room to begin with, and why was he not supervised, and where was anybody else? These are the questions that I have.
He reached out to help his wife get up from the MRI table, but the machine was still on, and it had one of the most powerful magnets on Earth inside.
I've had MRIs myself. I work in a facility that has MRI machines. There are warning signs everywhere relating to magnets.
It created a force 60,000 times stronger than Earth's magnetic field.
Whoa.
Suddenly, his necklace shot forward, violently dragging him headfirst into the machine, and he died the next day from his injuries.
maybe cause a cervical spine injury high up, or cause significant amount of brain trauma causing significant amount of bleeding. It also could have caused airway obstruction. It could have been hypoxic, causing anoxic brain injury. You'd expect maybe the chain would fall off.
If an anteater stuck its tongue through your mouth and into your stomach,
What? How many people have an anteaters crawling up on you? I mean, maybe if you're in the wilderness or you fell asleep at the zoo.
could it remove the food you ate with its tongue? Well, their tongues can reach up to 2 feet.
2-foot tongue. What?
The biggest tongue in the world.
It's almost the size of a nasal or oral gastric tube that we would use after we intubate somebody.
After that, as it scraped for food, its quick flicking motion could tear up the delicate tissues inside.
Once the tube that we put in your belly stays there, it's not doing this type of motion. Ripping the gastric lining out causes inflammation, can cause bleeding, can cause a peptic ulcer, could cause significant amount of pain and muscle spasming.
He lost half of his jaw.
So why would the person's jaw in the first place disappear like this? Could be a tumor, mass, cancer, could be infection that ate away at the bone itself. They would have cleaned out the rest of the bone on the jaw to make sure that it was healthy tissue.
Doctors sawed into his leg bone, cutting out a section and reshaping it into the curve of his jaw.
Cool.
Then they drilled in dental implants while the bone was still attached to his leg, and they attached a set of custom 3D printed teeth.
Ooh. Bone does have a blood supply if you're getting the marrow with it, basically. What we're seeing is muscle that's still supplying potential blood to the muscle piece as well as the bone, so that way it's still healthy and growing.
Once inside his mouth, blood vessels from the leg were stitched to vessels in his neck, keeping the new jaw alive. And tiny screws locked the bone in place, securing it to what was left of his original jaw.
Most likely this would be 2 different specialists that would do this. You want an oral surgeon, another specialist, likely a type of orthopedic surgeon.
His friend shot an arrow at the gas canister on his head. They were both drunk.
Of course. A lot of stories where gasoline is involved is not a sober story. Crazy, stupid, dangerous. Please don't do this.
The can hitting him instead. As it shot through his skull, it somehow missed all major blood vessels before coming out the back.
First instinct when it went through is to hold on and grab it. Please fight that instinct to pull it out.
And the man stayed conscious the entire time. Doctors treated him by drilling around the arrowhead and pulling the rest through. And even though he lost his eye, he survived without any brain damage.
Likelihood of the eye surviving is pretty low because it's such a specialized structure. That's amazing because that area, your brainstem, the midbrain where your pons is, all these structures, if there's injury to them, you're probably not going to be able to survive.
His plane was shot, and plastic shards from the windshield tore into his eyes.
Ow! It goes into the area of the eye where your cornea is, or the covered part of the colored part of your eye. That's gonna hurt like a son of a gun. Highly specialized cells that are innervated or have nerves, and they send really big pain signals.
Injuries like these usually cause swelling as your body tries to get rid of the foreign objects. But the plastic pieces didn't activate his immune system, meaning they could stay in his body for a long time without any harm.
That's a relative statement. They're staying there without an inflammatory response, but they're impeding or causing scarring potential formation. Maybe.
He figured if he could put this kind of plastic in someone's eyes, he could replace their damaged lens, curing their blindness. And he eventually invented the first permanent contacts.
I knew that the lens that doctors put into the eye, the ophthalmologist, is a type of polymer, aka type of plastic, but didn't know the background story of how this happened, which is pretty impressive.
His stomach grew into a potbelly over time. So he exercised regularly and didn't drink beer. After losing 34 pounds, it was still there. Doctors told him it was nothing, but he demanded a full body scan.
Doing the right appropriate thing to work out, change diet. But then when you go to the doctor and the doctor isn't gonna do an image, like what's going on? An ER doctor, at least here in the United States, is gonna get a CT scan of the abdomen.
They found a 30-pound tumor wrapped around his kidney. It took 6 hours of surgery to remove it, along with the kidney, but he fully recovered.
Most likely this is a benign tumor. So we have tumors, aka cancer. Cancers can be malignant, bad, or they can be benign, just growths, aka tumor.
It's a tumor.
Yeah, it's basically a laparotomy. They must have had to take the kidney because it was attached to it. You need one to survive.
If you get stabbed in the eye,
If you get stabbed in the eye, sorry that you were in that position. Don't pull it out. Please don't pull out the knife. Just leave it in place. If it just goes, say, in the white parts of the eye, the sclera, you're not hitting the specialized cells of the cornea. Won't hurt as bad, but you get worried that the fluid of the eye is going to come out.
place a cup around the knife and wrap it in gauze to stabilize it.
Yep. If you go through the colored part of your eye, you're going through the cornea, you're going through your pupil, but the pupil is just the window into the back of your eye where your cornea is. So you can hit your cornea, which can cause damage to that. If you get it all the way back into the retina, you could potentially have some vision loss in that specific area.
Then cover both eyes. This is because if one moves, the other moves too, which can tear the wound open even more.
Yep. Great advice to close both eyes, but make sure you have somebody with you because you don't want to be just trying to feel around and get yourself to the hospital.
Keep your head still and get to the emergency room, where doctors will carefully remove it before sealing up the hole in your eye.
Yes.
Yes.
Doctors sewing this up or fixing it or sealing it up, it's not all doctors. It's not emergency medicine doctors. This is specifically an ophthalmologist, and not every hospital has an ophthalmologist.
He inhaled a seed while walking through a forest, not thinking anything of it.
So crazy. How many times has a fly or a bug gotten in your mouth? It happens. But a seed, that's pretty rare. When they say inhale, I'm assuming it is into the lung.
It was so small, it didn't even make him cough.
Yep.
But it settled deep in his lung.
When somebody says deep in the lung, that means it's kind of gone through all the narrow passages. So your trachea, your mainstem bronchus, bronchioli, all the way down to the lowest area, which is the alveoli, which is unlikely that it got all the way there, but it got to basically a very small subsegmental area.
Over time, he started to feel pain in his chest.
You can feel pain in the chest due to irritation, due to infection, due to something potentially growing.
So he went in for a scan. Doctors spotted what looked like a tumor.
It's not a tumor.
Most times you're not going to immediately get a CT scan. You're going to get a quick screening chest x-ray to see if there is something there, obviously. The image that we're seeing here is actually probably an x-ray / a scout film. CT scanner is going to be a 3D view. This is just a 2D view image.
They found a small tree, nearly 2 inches long, growing inside his lung. It had taken root in the warm, moist tissue fed by his body instead of soil.
The body probably was also having a significant immune reaction, causing a lot of inflammation and swelling. There are multiple other steps that would happen before that happens.
If you happen to get kidney stones,
Kidney stones.
People have kidney stones for many different reasons. For me, anecdotally, I see often enough that usually it's familial, but there are other reasons why you could.
you could ride a roller coaster and let the shakes dislodge
Yeah,
them from the
100%
tissue
true.
walls.
There actually has been documented studies to show that getting on a roller coaster will help remove a kidney stone. But it's a little misleading here. They do not cause pain when they're in your kidney. It's when they leave the kidney and they go into your ureter, which is the tube from your kidney to your bladder.
Then, as the coaster moves, the change in speed shakes your whole body. And this makes them move into your bladder, where they can finally pass through when you pee.
Whew. Once it goes into your bladder, no more pain. All you're waiting for to happen is for you to urinate it out. When you pee it out, usually there's no pain. It's usually like a whoop kind of feeling. I have seen them occasionally get stuck within the urethra.
What's a urethra?
It's a tube from the bladder to the outside world.
If you instantly lost 300 pounds,
Do people who have had a significant amount of weight loss have excess skin that do need to have surgery to have it removed? Yes. Typically it's removed and tightened up, and you do have these line scars on your body.
surgeons could cut the loose skin along your torso and arms. Then they could stitch the extra folds together, joining them into wide wing-shaped flaps.
Did you guys know that your skin is your largest organ of your body? Could you attach your skin in this way surgically? Yes, you could. But you're going to have decreased functionality. You're not going to have full range of motion of your upper extremities or your lower extremities. You're going to be limited by what you can do on a daily basis.
The loose skin on your legs would also be cut on the inside, then stitched together. And once fully healed, the stretched skin would spread out like a suit. And if you jumped off a building, it could catch enough air to let you
Come
glide
on. Come on. Who would actually do this?
for just a few seconds.
Yes.
He shot twice from the car's window, sending both bullets straight toward the other man's head. Years earlier, that man had been in a car crash, and doctors used a thick metal plate bolted
Whoa,
in place.
that is a massive metal plate. So there must have been a lot of damage to that skull.
When the bullets reached him, they struck that same side of his head, and the plate deflected them.
Wow, he's wearing his own inner helmet. Amazing.
It's almost as if you're wearing a football helmet inside your own head.
If this was more directly right on the forehead, does it stop it? Does it cause a dent in it? Or does it actually break all the way through? Depends on the bullet, the speed of that bullet, and how close you are when you actually got shot.
Sending them out the back of his head instead of straight through his skull.
Whoa.
He collapsed on the ground as the car sped away, bleeding but still alive.
If this individual came to the emergency department, full evaluation, you're still going to get a CT scan of the head. The metal is going to give some reflection on the CT because of the radiation. It doesn't do well with metal, but you'd still be able to see if there's blood within the brain on certain areas.
If you have a lazy eye, you can wear these goggles which show a special version of the game Tetris.
Ooh. Medical fancy term for lazy eye is amblyopia, basically a neurodevelopmental problem, versus I see patients who have cranial nerve defects relating to their eye. It looks almost like a lazy eye as well.
Now, your good eye would see only the bricks on the bottom of the screen, while your lazy eye sees only the falling bricks. And this forces your eyes to work together, which strengthens the signals that your brain receives.
This works, but it's very specific to the lazy eye problem. The same idea, when people have cataracts, they can put new lenses into the eye. So sometimes people have issues with nearsighted or farsighted. They can do basically multifocal length of a lens in each eye, or a distance in one eye and a distance in the other eye.
They removed the lump, sliced it open, revealing hundreds of tiny teeth inside.
Whoa, I was like, is this a tonsil with tonsil stones? No, this is a lump with teeth in it. What? An odontoma has all the structures, machinery to make teeth grown off of the gum where your teeth would be.
When the boy was 3, a tumor appeared in his jaw, and as he got older, it only got larger.
Why did we let this poor gentleman grow up with an expanding mass in the mouth? Was it not identified? Was it identified later? Maybe no access to healthcare? I don't know, but these are my questions.
The tumor was made of the same cells that usually grow teeth. But unlike his gums, it didn't know when to stop. So it kept making more and more. And when the dentist dug into it, they found over 500 teeth crammed inside.
Wow, those must be either really, really small teeth or a very massive mass that we're not getting a good depiction of.
With some as small as a grain of sand.
Grain of sand.
We're nothing but grains of sand.
You probably have to take a look at under a microscope.
So they removed every extra tooth, giving him a normal smile.
He would probably be anesthetized, probably be intubated. Don't have him moving around because if there's complication, if there's a vascular issue, you don't want somebody moving around.
The cable snapped and fell on her face.
Whoa.
The ride operator did nothing. The girl pushed the cable off her, but part of it had become wrapped around her legs. Suddenly, the ride dropped, pulling the cable tight. It sliced right through her, cutting off her feet.
Whoa. Lower extremity pulled right off. That is awful.
That's awful.
What do? Stop the bleeding as best you can. Pick up the amputated pieces and get to the hospital.
They dropped to the ground below, where a crowd gathered to watch. Now, doctors were able to reattach one of her feet, but the other was too damaged.
You might have something called phantom limb syndrome, where you actually feel discomfort and pain in the foot that's not there. And then the one that actually comes back, or the one that you were able to reattach, you can have nerve damage for a very, very long time.
If you were pregnant with 10 babies at once, your belly would stretch to the size of a giant beach ball.
Yeah.
Inside,
whoa. You probably wouldn't go till full term, meaning full term, typically about 40 weeks, roughly 10 months, even though we always say pregnancy is 9 months.
If you tried to give birth, the babies would end up choking each other with their umbilical cords into a tangled mess.
These babies are not going to be the full growth size. When you start having more babies in there, you're not having them get that big. Each one, the weight of them is going to be a little bit smaller.
If you get a burn, take some skin from a tilapia and apply it like a bandage, would your injury heal faster?
It is true, but we're not just going out fishing and catching a piece of tilapia. Usually will heal on its own if it's a first or a second degree burn.
Fish skin stays moist over time, so it doesn't need to be changed as often as gauze. And the collagen inside can actually act as a natural building block for your cells.
These could be used in conjunction with regular grafting that we do versus, on its own as a temporary type of barrier to help the tissue grow. But they are a good utilization tool that has been used at hospitals. You're not going to become a fish person.
The surface is covered with bacteria, which could leak into your wounds and give you an infection.
There's a lot of other factors that go into it. Antimicrobial therapies, IV therapy, especially if there's a large surface area of burns, the pain management of this as well. And then afterwards, the scar formation that happens.
This is why the hospital cleans their fish skin with special chemicals first before placing it over your injury, helping your skin grow without the infection.
Has any of you out there ever had this happen to help a wound heal? Let me know in the comments.
The chainsaw kicked back and lodged in his skin, stopping just short of a major artery.
Major. This happens. I've worked at many trauma centers to where you see people with chainsaw injuries, especially ones that kick back at you. That is a common area, the neck or the face or the head. Zack D Films does a good job. You got your jugular vein and your carotid artery.
Rescuers rushed to help, but removing the chainsaw would have caused him to bleed out in seconds.
Have you not watched my show enough to know what I'm gonna say? Don't pull it out.
We went over this like for half an hour.
It is such a reflex as a human to grab it and try to pull it out right away. Do not.
They left it in place, carefully holding it steady as they took him to the hospital. And finally, surgeons were able to remove it, saving the man's life.
Taking it out when you're in the operating room. Surgeons there, so that way, if there is a potential cut in the major blood vessel, they're able to fix it right away. They use very small sutures, very small instruments to be able to hold on to the small vessel as well as their suture material or needle and repair it. Then they're going to repair the soft tissue as well.
If you grew to over 1,000 pounds, the pressure from your own body would start to crush on your internal organs, making it hard to eat. But if you did manage to keep gaining weight, lying down would flatten your lungs.
You have subcutaneous fat under the skin. You also have visceral fat around the organs. You could have difficulty having space for your organs, but then you have obesity, hypoventilation syndrome, or something called Pickwickian syndrome.
Pound for pound, your bones are actually stronger than concrete, meaning you'd have to weigh a massive 1,800 pounds before your skeleton would just collapse.
When we see people who are significantly obese, we see a lot of joint problems. You're starting to get early arthritis. The bones are growing on the side. You're getting osteophyte formations, worsening pains in joints, prevents you from walking, almost like a catch-22. Your joints get so bad that you can't move. So then as you don't move, you're not burning any calories, thus making your weight problem even worse.
If you took out your stomach and replaced it with a cow.
What? Come on. Who's thinking about this stuff?
Come on! Could you eat and digest grass?
Who's eating this grass like that on the ground?
Your abdomen would swell to the size of a water heater. And that's because cow stomachs actually have 4 chambers.
How cool is that?
You would have to eat several pounds of grass a day.
Grass in general is extremely hard to break down. Humans cannot break it down because of cellulose.
Chewing it and swallowing it, then burping it back up to chew again.
Regurgitation.
Regurgitating.
Our esophagus is not designed for that. We know that nobody likes to vomit. It hurts, it burns, increase the risk of esophageal cancer.
All that grass sitting in one of your stomachs would create about 50 gallons of methane gas every day. day.
Whoa, I feel like I do that now. No, I'm just kidding. A lot of people fart, but a lot of people don't fart. And you're just gonna have a significant amount of distension, abdominal discomfort. You're gonna be stretching tissue to an extreme that you're not really expected to. It's gonna cause a lot of issues.
The stray bullet struck him in the head, but he shrugged it off and kept on partying. He didn't even realize he had been shot.
Interesting. We do get stories like this, not just bullets, but injuries to the head, nail guns, nail going into somebody's skull, just missing certain parts of the brain.
A few days later, his arm started twitching uncontrollably. Confused, he rushed to the hospital, where doctors discovered the bullet. But it just happened to miss the vital areas of his brain, meaning he was okay.
The arm discomfort could be due to swelling versus a direct injury to that area. That's maybe why it was delayed, because there wasn't significant swelling right away. One of the indications to remove a bullet, typically if it's in your brain tissue, spinal cord, or if it's in a joint. Doctors would go in to attempt to get this removed, and you'd have a neurosurgeon do that for you.
As they cut open his chest, he started bleeding severely. And to keep him alive, they pumped him full of donated blood.
Sometimes you have vessels in weird areas. Not everybody is designed exactly the same. You might have hit a vessel and you had so much bleeding that you need to give blood. So you give packed RBCs versus whole blood. Typically don't give that often. Usually use separated components. You might need plasma, platelets, cryoprecipitate. There's a lot of different things you might need.
Ended up saving him. Because of this, he promised to donate his blood once he was old enough.
I have donated blood once. I stopped because I have a really rare blood type that I can only give to people who have the same rare blood type as myself, which is a small percentage of the population, AB positive, which is a universal acceptor. That same population can get blood from any other blood type.
When he did start donating, doctors discovered a rare antibody that could prevent diseases during pregnancy.
Interesting. What they're talking about is the anti-D antibody. We have a shot called Rogam that we give to pregnant women who might be negative blood type. The baby might be a positive. The mother might develop antibodies against that positive blood and attack it, which can lead to anemia, diseases, and even death.
The next 50 years, he donated every 2 weeks, enough for over 3 million doses of medicine, which ended up saving 2 million newborn babies, all because of donated blood.
Very cool, amazing. That's a lot of blood donation. How many of you out there donate blood? Let me know in the comments.
He snorted the paint up his nose.
Oh my gosh, what a good depiction though. You actually have 3 channels in your nose separated by bone, bone covered by mucous membranes.
Held his breath and blew air upward. This pushed the paint up through small tubes that connects the nose and the eyes until it reached his tear ducts.
So this actually happens when we have somebody who has a really bad nosebleed. We actually can see it go backwards through your tear ducts, out your eyes, and you're actually crying bloody tears.
The paint came out of his eyes and dripped straight onto the canvas below. You see, as a child, he learned air and liquid could pass from his nose to his eye, and years later, he turned that trick into art.
You shouldn't be having paint in your eyes. That can cause massive injuries. It might actually break down the tissue of the sclera, which is over the whites of the eyes. Definitely it's going to cause irritation to your cornea, which is the cells covering the colored parts of your eyes. Irritant to your mucous membranes, so it can break them down, maybe cause bleeding.
Eventually, he became a world-famous painter, selling each painting for thousands. But this can cause serious damage to your eyes, so you probably shouldn't try it.
Sometimes you can get infections into these areas called dactylocystitis, which require heavy antibiotics. You can also have dysfunction of the tear ducts, which actually will lead to drying of your eyes.
You could stuff a tire in your mouth.
Stop it. Don't even try this. No, I don't even believe this can happen. Don't do it. Not worth it.
If your cheeks were like a hamster's.
Yeah.
That's because you would have an extra 2.5 square feet of skin that would be able to stretch to your shoulders.
Very cool that small little rodents, animals can be able to put a lot of food in their cheeks like the squirrel, but humans were not designed to do that. We puff out our cheeks to a certain amount, but there's a lot of muscle there that prevents that from happening.
With so much space, you could fit over 60 Big Macs. And with all that food, your mouth would need to make 7 cups of saliva.
Oh, how gross is that? Who are saliva-phobes? I think I just made up that word.
Who was made up?
Let me know in the comments if that's one of your pet peeves. A lot of people in medicine are like anti-saliva. The respiratory therapist can handle it, and most people in the emergency department have no problem with it.
He grew all the way to 7'7",
Whoa.
and people were so fascinated by his height that they started bidding for his body before he even died.
This person probably had giantism, which is a inappropriate amount of growth hormones created by your pituitary, which was caused by a pituitary tumor. It happens at childhood while your growth plates are open. Similar to acromegaly, but acromegaly occurs in adults.
Back then, doctors would buy corpses to cut them open and see how they worked.
Yes, they did. Sometimes they bought them. Sometimes there was a bad industry of grave robbing. They wanted to learn about the human body. It wasn't like it is now where there was like a lot of donations for cadaver lab at all the major universities.
If you were blind, you could put on these glasses that record everything in front of you through a tiny camera,
Cool.
which sends the signals into the device on your tongue.
What?
What?
Interesting. I wonder if this is used for somebody who's already seen objects. I wonder if all that saliva that you make is going to get messed up because now you have a device in your mouth.
Your tongue has some of the most sensitive nerves on your body, and the tiny zaps would create patterns that you could actually feel.
Might actually be increasing the production of saliva, might cause irritation or chronic changes to your tongue as well. I have a lot of questions about this, obviously.
Oh, hey, I got another question there.
With practice, your brain can learn to interpret them as shapes and objects, letting you walk safely through a doorway using your tongue instead of your eyes.
How many of you would be walking around with a plate on top of your tongue getting zapped to be able to see vision? Let me know if that's something you'd be interested in.
If you crash while riding a motorcycle.
Motorcycle crashes are a real thing that we see in the emergency departments, and this graphic doesn't show any protective gear, so yes, you have a higher chance of causing a significant amount of trauma to your body.
Doctors would first make a cut on your neck, separating the head from the body, and the blood vessels are connected to another one.
We don't just jump to cutting somebody's neck and separating your head. Most common injuries relating to motorcycle accidents: head injuries, concussions, intracranial bleeding, fractures, scrapes, bruises, abrasions. Sometimes you'll see collapsed lungs due to either a rib puncturing the lung or just a blunt force trauma to the chest.
The muscles, bones, and tendons are precisely cut and left in their original positions. The surgery would take hours to reconnect everything.
Transplanting somebody's head. We can reattach muscles, the tendons, the blood vessels, but when it comes to the nervous system and the functionality of it there, we're not at the ability to have that function for us yet.
The table starts to spin the mother around as she was giving birth, and this could generate up to 8 Gs of force.
What normally happens when somebody's giving birth, there's many different mechanisms that are happening. Hormonal signaling, the uterus starts contracting, trying to help push the baby down, move the process to where the baby gets closer to the outer world, basically.
Doctors have banned this practice because mothers start shooting babies out like machine guns.
They do show a bunch of fluids going around the room. Yes, that could happen. The amniotic fluid, you would have blood, you might have urine, and then you may even have feces as well.
You'll fart, pee, puke, and poop.
If your face suddenly turns paralyzed, that's a bad sign.
If you have difficulties moving your face, difficulties smiling, there's asymmetry. That is a concern that you might be having a stroke. Could be something different, but that is our number one concern because stroke symptoms are time sensitive.
Try to smile. If only one side of your face moves, that's a serious warning sign. Now, raise your arm in front of you and keep it steady for a few seconds.
Oh, you can have some interventions within the first 24 hours, but that's only if there's what we call a large vessel occlusion, where the doctor can go in and actually take out the blood clot. Outside of that, there's not much to do except say, this is the damage that happened. This is what we're going to do to figure out why you had this happen and what we can do to help prevent them from happening in the future.
He slipped on falling on a drill bit, penetrating from his right eye to behind his ear.
The eyeball is going to be gone at this point. The damage to the eye is probably irreparable, but then the question ends up being what type of brain trauma injury has occurred. But what do I always say? Don't pull it out. Leave it in place, get to the hospital ASAP.
Rushed quickly to the hospital. The doctors forgot that the metal should be removed before before the MRI.
We can't put people in an MRI machine with metal because the M stands for magnetic. It will pull, rip, and move and cause damage not only to the machine, but it can kill the person and damage maybe other people around.
This resulted in an unexpected outcome. The drill bit ended up in his and so the man became pregnant.
Oh my goodness. We do have people that come in with trauma to the rectum and foreign bodies up in that area. You have to worry about perforated bowel as well as trauma to the anus, lacerations, abrasions, contusions, blood loss, as well as fecal material within the abdomen, increasing the risk of sepsis.
The bullet was shot and lodged in his chest, but doctors said it was too close to his brain, so they decided to leave it there.
Chilling in your heart, they probably don't want that hanging out in there. Reasons why you would actually remove a bullet: brain, spinal cord, joints. Majority of the time, we leave the bullet in.
He grew up and led a normal life, but at the age of 78, his belly began to grow, so he went to the hospital for tests.
Having nonspecific abdominal distension over a period of time, you think mass, tumor, obstruction, liver disease. When somebody comes to the emergency department, we'll actually do a workup and we'll probably just get basic blood work, kidney function, get a CT scan of your abdomen after we do a physical exam.
He discovered he was pregnant, and 9 months later, he gave birth to a bullet baby. If your eyes point in different directions, a doctor will make a small incision in your eye.
This person is being depicted as having bilateral exotropia. The eyes are looking laterally. This could be due to a nerve problem. This could be due to a muscle problem.
He licks the buttons on the controller that control the movements in the game.
We are never getting GTA 6.
You have people that are able to move their eyes to activate devices, or even Neuralink, which is actually in an individual now, to be able to reactivate areas that weren't active before due to neurologic injury.
When he was a child, he fell off his bike and his body was paralyzed except for his tongue.
Spinal cord or brain injury. His body was paralyzed except for his tongue, but he doesn't have a trach, hole in his neck. For an airway, then it's a lower cervical spine injury, most likely.
If you took out all the bones in your body.
Oh. Could you actually remove the skeleton out of our body? Unlikely.
Removing the bones from your body is technically possible, but you would look like my bulldog's nuts. However, if you managed to replace them with a Lego skeleton, you probably wouldn't even be able to stand up.
If you have such a badly destroyed bone, an orthopedic surgeon will be putting different pieces of metal in your body. Sometimes they're metal rods, sometimes they're plates with screws.
If you tear your fingernail like this, you may experience severe pain.
Very painful for this to happen. Increased risk of infection, increased risk of what's called a paronychia, which is an infection in the area where you can get some purulent material and discharge, which is easily treated by just a small puncture to that area.
Instead, tie a knot in some string. Attach it to a door and make sure it opens outward. Now, when someone opens the door...
Oh my gosh. The skeletal structure and the muscles look pretty cool. It looks like right out of an anatomy textbook, but this degloving of the whole skin off your body, unlikely. But we do see it happen to different parts of the body. I've seen it happen to hands, arms, feet. I've seen it happen to scalps before due to significant trauma.
Place it into the baby's nose, then gently suck through the mouthpiece to pull out their mucus.
Yeah, okay. These things do exist. These are nasal aspirators. The parent or the adult uses for manual suction. You can suck out into the tubing or into the device and then discard it.
Instead of sucking, you should blow hard so the baby will inflate like a balloon and explode.
Do not blow air in, no, so that can mess with somebody's airway, could hyperinflate the lung, and could cause barotrauma as well as trauma to the upper airway. Will you cause your child's head to explode? No, but you can cause undue pressure, pain, discomfort to an individual.